Causes of low back pain and how to manage it. Did you know that 80% of people will experience back pain at some point in their lives? Once you have experienced back trouble, it has a tendency to recur, and so be careful to protect your back. Back pain is usually caused by minor strains in the muscles or ligaments, but more serious lower back pain usually is the result of an injury to one of the many joints in the base of your spine. The injury usually happens while bending your spine forwards, especially while lifting something heavy. Today, we're diving deep into the main causes of back pain and how you can avoid them. Plus, we'll share some simple lifestyle changes, effective exercises, and daily habits to help you live pain-free. Even though back pain is mainly caused by minor strains to the muscles and ligaments of the back, sometimes it can be the symptom of some serious underlying conditions, and I will mention them in the later part of the video, so be sure to watch until the end. First up, what are the main causes of back pain, and how can you avoid them? Well, back pain can come from a lot of things: poor posture, lack of exercise, and even stress. To avoid these, make sure you keep an eye on your posture, stay active, and find ways to relax. Posture is a big deal when it comes to back pain. How does posture impact back pain, and what can you do about it? When it comes to sitting, avoid sitting for long periods. Your knees should be higher than your hips and your back straight. Slouching can put a lot of strain on your back. Make sure to sit up straight and your screen at eye level while using computer or at work. When lying, use a low pillow and lie on your side. Do not lie face up or face down. Use a mattress that suits you. Try a firm one first. Here's how you can tell whether the mattress is right for you or not. If you wake up with a sore back or find it hard to get comfortable at night, it might be time for a new mattress. A good mattress should support your spine and keep you comfortable all night long. Avoid lifting anything heavier than 10 kg. Squat close to the load and keep your back straight. Do not stoop over the load to get a grip and pick it up. Lift using your knees and legs, not your back, as leverage. Keep your back straight, not bent forwards or backwards. When scrubbing floors and gardening, your hands should be as far forward of you as necessary to keep your back straight. Do not flex your back by having your hands working too close to your knees. For bending activities like tying shoelaces or putting on socks, put your foot on a stool, chair, or box that is near enough to your body and high enough so that you do not have to bend down to your foot. Regarding sports and exercise, be careful of sudden twisting movements and sudden overloading of muscles, as in golf, squash, sailing, weightlifting, and horse riding. Walking, jogging, and swimming are good activities if you can manage them. Some researches reveal that exercise can reduce back pain by up to 60%. The purpose of these exercises is to strengthen the various muscles that support the spine, especially the abdominal muscles and the extensor muscles of the spine. The muscles of the spine and abdomen support the spine better than any brace or corset. If you have chronic, nagging back pain, it is likely that performing these exercises religiously for 3 months will greatly reduce it. The first exercise is knee-to-chest raise. To perform this exercise, lie flat on your back, bend one leg up, grasping it with your hand just below the knee, and bend your head forward so that your forehead approaches your knee. Hold for 5 seconds. Repeat on the other side. The second exercise is straight leg raise. Lie on your back. With your leg perfectly straight, raise it as high as you can. Repeat with the other leg. Take this to the limit of pain. The third exercise is back arch. To do this exercise, stand up straight, feet pointing directly forwards and apart as wide as your shoulders, hands placed on your back. Breathe in and breathe out slowly. As you breathe out, bend backwards as far as you can while supporting your back with your hands and keeping your knees straight. Hold your lower back arched for 5 seconds, then return to the neutral position. The last one is pelvic roll and one-sided stretch. Lie on your back. Then, bend up the leg on your painful side and stretch it across your body while you turn your head to the opposite side. Use your hand to reinforce the stretch on your bent leg. Do these exercises at least twice a day for no less than 5 minutes at a time. Rest between each exercise. The exercise may be uncomfortable at first, and initially each one should be repeated only 2 to 3 times. If there is any problematic pain with a particular exercise, stop doing it. And the most important thing is you should consult with a doctor or physiotherapist before doing these exercises if you have back pain. Because as I said before, sometimes back pain could be due to some other serious underlying conditions other than just muscle and ligament strain. Here are some red flag pointers of low back pain that you need to be careful about. If your age is more than 50 years old or less than 20 years old, we need to consider osteoporosis. Constant severe pain that disturbs your sleep is also another red flag pointer, and you need to be careful if you have fever or if you notice unexplained weight loss. If your back pain is not relieved after 1 month, we need to investigate further to look for serious underlying conditions. If you are taking medications like anticoagulants or corticosteroids, let your doctor know if you have low back pain. As I promised you above, I will tell you some serious underlying conditions that can cause low back pain. I do not mean your low back pain is caused by these conditions and they are rare, but you need to be careful if you have low back pain, plus red flag pointers mentioned above. If you have history of cancer or unexplained weight loss, cancer or metastasis to the bone should be considered. Low back pain can also be caused by medical conditions like ruptured aortic aneurysm, carcinoma of pancreas, tuberculosis, osteoporotic compression fracture, or other fractures. Sometimes depressed people also present with low back pain. So, if you are concerned about your low back pain, don't take it lightly and consult with your doctor. Low back pain is a common condition that affects 80% of the global population, but luckily at least 50% of people recover within 2 weeks, and 90% of people will recover within 6 weeks. It most commonly occurs in those aged 30-60 years, the average age being 45 years. Sometimes low back pain can be caused by underlying kidney problems, so if you are concerned about your kidney condition, watch this video to know what other symptoms you will have if your back pain is due to kidney problems.